Hello everyone. Today we'll discuss about depression and obesity connection. What comes first, depression or obesity? Does obesity causes mental health issues or mental health issues cause obesity? What should we do? Should we treat depression only or should we treat these two together? Let's discuss this in detail. Obesity increases inflammation in the body, and inflammation in the body increases inflammation in the brain or fire in the brain. What is the meaning of inflammation? Actually, inflammation is a medical word and it is related with impaired immune system. So, depression is an inflammatory disease, but where does this inflammation come from? Means fire in the brain. The causes of fire in the brain: stress, dietary factors, disordered sleep, lack of exercise, smoking, gut permeability or poor gut bacteria. We'll discuss this gut permeability later on. We'll focus on obesity, how this is associated. Even antidepressant medication give relief to us by working on our immune system. So the central core is impaired immune system in depression and obesity. So part 1, 2, 3 we'll discuss obesity and mood connection today, and later on food and mood connections and integrative medicine approaches for depression and weight loss at last. So today we are going to discuss how depression and obesity are interlinked. The mechanism: one is the psychological factor, that is poor self-esteem associated with weight gain, overweight, obesity, that's associated. But more is the biological factors. When you are eating more sugar, carbohydrates, sedentary lifestyle, what will happen? Your pancreas will increase hormone insulin. What's the role of insulin? It manages blood sugar levels. So if you are eating more, not exercising, so more and more insulin will increase. If more and more insulin would be there, what will happen? It will clear more blood glucose level, blood glucose from blood vessels. Then what will happen? Low blood glucose levels. If it is there, your brain is very much sensitive to hypoglycemia. So mood disturbances would be there because brain needs energy and brain is very much sensitive. Usually obesity is a process towards diabetes. Initially insulin increases to maintain blood sugar levels. After some time, what will happen? If the individual habits are not changing, they are not exercising, the blood sugar level will also increase, and initially this is called insulin resistance, but it is a progression towards diabetes. That's why diabetes is associated with depression. So this is how, because of this medical factor, if person is eating carbohydrate rich diet and no exercise, sedentary lifestyle is there, this insulin resistance means more and more insulin to compensate your energy needs is related with hypoglycemia and mood fluctuations and mood swings. Means medical factor is responsible for depression here. So we need to manage depression and obesity together. So there is evidence-based data about obesity and depression, overweight, obesity and depression, meta-analysis of longitudinal studies, and this is the Indian data about metabolic syndrome and central obesity. What's the meaning of metabolic syndrome? Insulin, more and more insulin is associated with your hypertension, more cholesterol levels, and these all are interrelated. And this is associated with depression or fire in the brain or increased inflammation in the brain. So this is how this is associated with depression. In the next video, we will discuss food mood connection and we'll discuss what should we eat for healthy brain. Thank you very much.